Hi, this is Kristinista Health, and I'm here to talk to you today about MTHFR and pregnancy. As always, please speak with your doctor before changing any supplementation during pregnancy. So 2 books you'll want to check out are It Starts with the Egg, 3rd edition by Rebecca Fett, and Dirty Genes by Ben Lynch, as well as MTHFR.net, especially Dr. Lynch's article on MTHFR and pregnancy. Real Food for Fertility and Real Food for Pregnancy by Lily Nichols are also good basic nutritional books for using real food to support preconception health and pregnancy health. All mothers and fathers, for that matter, benefit from at least a 90-day preparation period for pregnancy. However, especially at risk are people who have 2 copies or are homozygous for MTHFR C677T, and also those who are older parents. So this goes with both egg quality and sperm quality, which both contribute to the health of the future child. B vitamins such as folate and B12, choline, etc. are vital to a healthy pregnancy. And it's harder for an individual with homozygous C677T MTHFR to uptake folate. And also, as we age, it may become harder to uptake nutrition from our food. There can also be complications with pregnancy as well if the mother has MTHFR, but particularly if they are not in a healthy condition or they are not supporting their MTHFR appropriately. The hard part is the MTHF polymorphism may not be particularly problematic until one goes to try to conceive a healthy child. I found numerous studies in PubMed discussing MTHFR C677T with a higher risk for Down syndrome babies, which I can link down in the show notes. Down syndrome usually happens in the sperm or egg long before pregnancy. Of course, there are many other possibilities of chromosomal abnormalities other than Down syndrome. A lot of these chromosomal abnormalities account for many of miscarriages. Of course, there are other factors associated with loss that are connected to MTHFR as well. I also found PubMed articles which showed the risk of NTD, neural tube defects, and this would be because the folate uptake during the early stages of pregnancy affects the neural tube defect. I found one PubMed article, 311-33774, which showed that MTHFR and improper supplementation may result in autism. However, there may also be increased risk for preeclampsia, HELLP, or clotting issues in pregnancy as well. Rebecca Fett, in her book, It Starts with the Egg, talks about the importance of B12 deficiency, which may have a link to MTHFR and is essential to fertility and preventing miscarriage. She points out the most useful test for B12 is serum MMA, which should be less than 270 nmol per liter. B12 can cause a buildup of metabolic toxins that harm egg quality, increase the risk of miscarriage, and cause problems during pregnancy. Also, high homocysteine can be caused by a B12 deficiency, which may cause early pregnancy loss, neural tube defects, and low birth weight. Problems with MTHFR appear to reduce the bioavailability of B12. B12 deficiencies are 4 times more common in those with homozygous C677T polymorphisms. If you have a slight B12 deficiency, it can be magnified by high homocysteine. So Rebecca recommends 1,000 to 2,000 mcg B12 per day. So you'll want to avoid cyanocobalamin, and you'll want to gravitate toward hydroxocobalamin, adenosylcobalamin, or methylcobalamin are all natural forms that can be absorbed. Some doctors recommend a short stint of 4,000 to 5,000 mcgs per day for 1 month to quickly replenish stores. So 40% of the population has 1 copy of the A1298C, which causes a mild 20 to 40% reduction in folate processing. Having 2 copies of A1298C or 1 to 2 copies of the C677T causes more impact. 2 copies of C677T reducing enzyme activity by 70%. The significant decrease is for about 10% of the population, which also can have a higher homocysteine. It is the excess of homocysteine that is thought to contribute to infertility and possibly cause miscarriage risk in those with MTHFR. High homocysteine contributes to DNA damage, but may also increase the risk of blood clots as well. Overall, there is much debate on how this affects pregnancy, but if there is an effect, you can easily correct with supplements, which is the main takeaway. You can ask your doctor about the MTHFR test, although it might not be covered by insurance. You can also order it yourself, or you can use 23andme.com and then upload your data to other systems for decoding. Either way, you can take some basic prevention, such as appropriate folate supplementation, regardless if you know you or your partner's MTHFR status. Rebecca ultimately recommends 800 to 1,000 mcgs per day. However, some supplement with way more than that if they know they have an issue. One doctor I consulted with for recurrent loss recommended 1,000 mcgs menthol folate in addition to a gold multi for men. Sometimes also a B complex twice daily, as well as CoQ10. I found one study, PubMed 28689-805, where their participants did menthol folate 5 milligrams per day, vitamin B6 50 milligrams per day, and vitamin B12 1 milligram per week. In preparing for my last pregnancy, I believe I was taking good prenatal, 1,000 mcgs menthol folate, 2 mentholated B complex vitamins, as well as 100 milligrams B6, because I was under a lot of stress at the time. If you don't do well on menthol folate, then you might consider folinic acid, and please don't confuse this with folic acid, as that is the synthetic version that you don't want to take. Rebecca also mentions the importance of NAC with an MTHFR polymorphism, especially if you have a history of recurrent miscarriage. Rebalancing fat intake through higher intakes of fish, olive oil, nuts, and seeds, and a somewhat lower intake of saturated fats from coconut, oil, butter, and red meat may be especially important for those with MTHFR, as it might help lowering homocysteine levels. I like to take Nordic Natural's prenatal DHA, and you might also consider the Mediterranean diet. As mentioned, MTHFR can also be linked to blood clotting issues and recurrent loss. The lack of menthol folate can cause a buildup of homocysteine, which increases blood clotting and therefore may reduce blood flow through the placenta. A lack of active folate may also cause DNA damage in eggs and sperm. Lastly, you want to avoid synthetic folic acid, even if it's added to baked goods. Just check the label. So key nutrients from food that you will want to pursue are riboflavin, which is found in liver, lamb, mushrooms, spinach, almonds, wild salmon, and eggs. Folate, which is found in green vegetables, beans, peas, lentils, and squash. Cobalamin, B12, which is found in red meat, salmon, clams, mussels, crab, and eggs. Protein from beef, lamb, fish, poultry, eggs, and dairy. Beans, peas, lentils, broccoli, nuts, and seeds. Magnesium from dark leafy greens, nuts, seeds, fish, beans, avocados, and whole grains. So as I mentioned, I consulted with a recurrent loss MTHFR specialist, and he recommended a number of tests to check on. Plasminogen activator inhibitor 1, protein S activity and antigen, protein C activity and antigen, antithrombin 3 panel activity and antigen, prothombrin G20210A, gene mutation analysis, MTHFR, of course, lupus anticoagulant evaluation, anticardiolipin antibody, IgG, IgM, IgA, and Leiden 5-factor mutation analysis. So there's a lot of talk in forums about the use of lovenox and other blood thinners in recurrent loss. But I imagine this is connected to having more than just MTHFR problems, or perhaps it is in cases where homocysteine is already high. I was able to get by with a low-dose aspirin and fish oil in pregnancy. So one study that I found that took place in Iran, which was study 31448666, showed that MTHFR C677T could be associated with preeclampsia. It certainly makes sense, as some of the same nutrients that support pregnancy with the MTHFR polymorphism also help prevent preeclampsia. PubMed 25758986 also found a similar risk in Asians and Caucasians who had C677T. PubMed 2499145 found that C677T may have an association with HELLP as well. The Natural Way to a Trouble-Free Pregnancy, the Toxemia Thiamine Connection by John Irwin mentions that taking just 100 milligrams daily of thiamine might help prevent preeclampsia. As mentioned earlier, Dr. Ben Litch has a lot of helpful information on his website, MTHFR.net, especially his article, MTHFR and Pregnancy, as well as the Start Here button. Mainly, I gained from him that you want to start slowly with menthol folate, B complexes, and B12, watching for how you feel. Do you have increased anxiety, headaches, other associated issues? You may want to take it slower and scale back. Are you having additional symptoms, like not feeling like you're properly supported? You may need to increase again. He talks about the importance of choline throughout pregnancy and breastfeeding, which is something that I definitely agree with. Choline has been shown to possibly prevent preeclampsia. Also, choline seems to support the breastfeeding experience as well. I hope that you are able to have a healthy pregnancy with your MTHFR polymorphism. As always, please speak with your doctor before starting any supplementation in pregnancy. Thank you, and I hope you have a great day.